Welcome to Indiana News Desk. I'm Joe Wren. Well, it's been more than 2 years since HIV rapidly spread through the small town of Austin, resulting in an outbreak that shocked the nation. Health officials diagnosed nearly 200 people with the virus within a year. They say it spread so quickly because people were shooting up a powerful prescription painkiller called Opana and sharing needles. As Barbara Brosier reports, like the people, the community is in recovery.
This Austin neighborhood is often referred to as the epicenter of Indiana's HIV outbreak. At the height of the public health crisis 2 years ago, there was constant foot traffic. People who neighbors say would do anything to find their next fix. These days, it's quieter.
We even had somebody that at the local grocery store the other day, we were just there and they were like, you know, we don't see those prostitutes like we used to anymore.
Scott County Public Health nurse Brittany helped start the state's first syringe exchange program in the wake of the outbreak. It was located just off Interstate 65 on the outskirts of town, but has since moved to a more accessible location, within walking distance for many of those who rely on the program. Combs says they've handed out hundreds of thousands of needles and gotten almost just as many back.
For last year, it was 98% return rate, which CDC says is pretty much unheard of. Like anything over 50%, they said is good.
There are nearly 600 people signed up for the program. About 1/3 are regulars. Combs sees Scott County's response to the HIV crisis as a success story. But perception of the program is still a problem.
To be honest with you, I'm firmly against the needle exchange program. You know, I don't think it really solves anything. I think it just masks the issue.
Brett Mayer is one of many people in Scott County who's been personally touched by the drug epidemic.
I've had 3 friends overdose in the past, couple months. Close friends, people I would consider family.
But Mayer says he doesn't have sympathy for those in the community who are battling addiction. He sees it as a mindset instead of a disease, and says the needle exchange is only fueling the problem.
They pull these people over, and because they have this needle exchange card, they can have 100 needles in their car or however many it may be. It's just pathetic.
Clyde Polly shares the same opinion, even though his son was directly impacted by the HIV outbreak.
The authorities would probably say there's great change, but if there's any change at all, it's very minimal. There's druggies everywhere. They're on every corner.
Polly says people in his neighborhood don't have much going for them. Unemployment in Scott County is higher than the state average, and this area consistently comes in last in an annual county-by-county health ranking of Indiana. Polly says even if people want to leave Austin, many are stuck.
This house is paid for, but it'd be hard for me to pull up stakes and leave.
Combs says those types of negative comments are hard to hear. She's poured her heart and nearly all of her energy into trying to help the community she works in.
It took us generations to get in it, and it's going to take us a long time to get out of it.
She acknowledges there are areas that need improvement. There's still a drastic need for homeless shelters and stable housing in Austin, which makes the relapse rate high. But more people have health care coverage here than they did 2 years ago. Combs says the health department often goes weeks without diagnosing a new case of HIV. 2 years ago, they were seeing just as many cases in 1 week as they would during an entire year. Combs says whether people like it or not, it's proof the syringe exchange is working.
We have a lot of people that are in the program that are negative for HIV still. They were negative 2 years ago and they're still negative now. And so that was our goal with the needle exchange, just to make sure people stop that spread of disease, and we've done it.
For Indiana News Desk, I'm Barbara Brosier.
Recently released state data shows Scott County by far had the highest rate of opioid overdose deaths from 2011 to 2015.